Hi all, welcome to OET speaking. Today we can discuss an OET role play. Here the setting is a hospital ward. You are talking to a 68-year-old patient who is admitted to the hospital where you are a registered nurse. The patient has obstruction to the coronary artery and requires angioplasty. She lives her own since her husband's death. Her current medical history indicates that she may need to look at lifestyle changes. Task: inform the patient about her condition and further procedures. Collect the details about her diet, exercise, smoking and drinking habits. Convey the patient that lifestyle changes can be made easily. Emphasize the need for exercise and healthier foods. Yeah, this setting is a hospital, so the patient is known to you. We need to ask the name of patient during our preparation time, so you can ask, how may I address you during our conversation? Let's assume the name is Mrs. Maria. So you can start your conversation by saying, good morning Mrs. Maria. My name is Sarah. I am your attending nurse today. Mrs. Maria, how are you feeling now? Probably as per the interlocutor's card, she may tell you like, sister, I am okay. Then we can tell her, oh, I'm really glad to hear that. Then, as per our first task, we need to inform the patient about her condition and further procedure. So you can tell her like, Mrs. Maria, I'm here to inform your test result. Is it the right time to discuss the report with you? Then you can tell her like, Mrs. Maria, I'm so sorry to tell you that you have blocks in your heart blood vessels. Therefore, a surgery is needed. Probably, as per the interlocutor's card, she may become anxious. Sometimes she may ask you like, sister, is it very critical? Then we can tell her like, unfortunately, I'm really sorry to inform you that you have almost 4 blocks in your heart. You can explain how it happened. So you can tell her like, the blocks are caused by high levels of blood fat. So it is really important that you need to undergo a surgical procedure for the removal of obstruction. You can tell her like, unfortunately, I am really sorry to inform you that you have almost 4 blocks in your heart. The blocks are caused by high levels of blood fat. So it is important that you need to undergo a surgical procedure for the removal of obstruction. Is that clear? Sometimes patient may ask you, sister, is it mandatory? Then we need to reassure her and we can tell her like, Mrs. Maria, I do really understand your situation. It's understandable to feel worried in this situation. Try not to worry, you are at the right place. We all are here to help you. And Mrs. Maria, surgery is mandatory to remove your blocks now. And as per the interlocutor's card, she may ask a question like, sister, could you please tell me about surgery? Then we need to explain about the procedure. So we can tell her like, Mrs. Maria, your doctor has advised for angioplasty. Mrs. Maria, your doctor has advised a procedure for you which is called angioplasty. It's a minimal invasive procedure. During the procedure, a specially designed catheter with a tiny balloon is carefully guided through the artery in your groin or wrist area into the blockage. Then the balloon will be inflated to widen the opening and increase the blood flow to the heart. A stent is often placed during the procedure to keep the artery open after the balloon is deflated and removed. Am I clear to you? Explain about the procedure like, Mrs. Maria, your doctor has advised angioplasty for you. It's a minimal invasive procedure. During the procedure, a specially designed catheter with a tiny balloon is carefully guided through the artery in your wrist or groin area into the blockage. Then the balloon will be inflated to widen the opening and increase blood flow to the heart. A stent is often placed during the procedure to keep the artery open after the balloon is deflated and removed. Am I clear to you? And as per our second task, we need to collect some details. So we can ask permission for that. You can tell her like, if you don't mind, can I ask you some questions for my better understanding? Probably the patient may tell you, yes sister, you can ask. Then we can ask about her food habits, exercise and smoking and drinking habits. First you can ask question like, Mrs. Maria, what kind of food do you prefer to eat? Probably as per the interlocutor's card, she may tell you like, sister, I prefer fast food. Then we can tell her like, Mrs. Maria, this fast food contains high levels of sugar, salt and fat, and it's not a healthier option for you. It will increase your blood fat levels. So I suggest you to cook some healthy foods yourself. As per the interlocutor's card, she may tell you like, sister, I am alone, so I don't prefer cook food for myself. At that time, we can offer some suggestion like meals on wheels. So you can tell her like, Mrs. Maria, I do really understand your situation, so I can arrange meals on wheels service for you. They can offer healthy food which includes more fibers, fruits, green leafy vegetables. It will be really beneficial for your health. Is that okay? Only as per the interlocutor's card, she may agree with you. Then we can tell her, oh Mrs. Maria, I'm glad to hear that. As per our task, we need to ask about her habits. So you can ask question like, do you have any habits like smoking or drinking? As per the interlocutor's card, she may tell you like, she is having habit of smoking. Then we can ask question like, would you mind how many cigarettes you smoke a day? If she tells you like, sister, I have reduced my smoking, before it was around 20, now I smoke only 10 cigarettes a day. Then we need to appreciate her effort. So we can tell her like, I really appreciate your effort for reducing the number of cigarettes. In your situation, it's very essential to quit smoking habit. The patient may tell you like, sister, I know it's not healthy, but I don't know how to quit. Could you tell me some solution for that? Then we can ask her, are you ready to follow my instructions? After getting her permission, we can tell her like, Mrs. Maria, I know it's very difficult to quit smoking suddenly. In your case, this is the right option for you. Quit smoking is the right option for you. If you are ready to follow, I can offer some suggestions. Is that okay? After getting the permission, you can tell her like, I'm happy to hear that. First of all, I would like to inform you about the alternatives available in the pharmacy to stop smoking, such as nicotine patches, nicotine gums, electronic cigarettes. Mrs. Maria, these all things will help you to stop the urge for smoking without any problem. Are you getting me? You can tell her like, Mrs. Maria, please fix a definite date in mind to stop smoking. Another thing I would like to mention that there are many support groups and programs available which helps quit smoking. You can make use of these groups after your discharge. How does that sound? As per our last task, we need to ask about her exercise pattern. So you can ask question like, are you doing any exercise regularly? Probably the patient may tell you no. You can tell her, Mrs. Maria, exercise is very important. It will be very beneficial for your recovery. And do mild exercise inside your room, such as walking for 5 to 10 minutes a day. It will be really helpful for you. You can ask, are you okay with my suggestion, Mrs. Maria? We can ask, do you have any other concerns? If there is no other concern, we can wind up by saying, thank you, Mrs. Maria. Once again, I assure you that if you follow a healthy diet, modify your lifestyle and habits, you will get a faster recovery following your surgery. Am I clear to you? Mrs. Maria, if you need any more help, Press the bus, sir. I'll be available here to help you. Thank you, Mrs. Maria. I wish you a speedy recovery. In this way, you can end up your role play. Thank you.